During Garbhasanskar workshop, one of the expecting mom asked about gestational diabetes. She asked, "What is this? How will I be able to manage it? Will it affect my baby? Will it affect my entire pregnancy? What are the risks and how to manage this during my pregnancy?" Then I thought I'll make a detailed video on this so that it will help many other moms. So whenever a mom is diagnosed with gestational diabetes, there are so many queries and concerns related to this. But if you take correct action at correct time, then you will be able to manage it properly and avoid high insulin injections as well. Hi, I'm Smita Pradhan. Today we'll be discussing about gestational diabetes during pregnancy. Gestational diabetes is a type of diabetes when a woman develops during pregnancy only. Around 2 to 10% of pregnancies are affected by gestational diabetes. This occurs when the pregnant woman's body is not able to produce enough of insulin. And insulin is the hormone which is needed, which is released by your pancreas, which is needed to allow the entry of glucose into the cell and that convert into the energy. However, during pregnancy, a woman's body goes through a lots of hormonal changes and other changes as well. And that does not allow the insulin work properly and body's insulin resistance increases a lot. So the glucose remain in the bloodstream for longer duration and that is when the blood sugar level rises. This condition is known as gestational diabetes. When the level of glucose increases in the bloodstream, the glucose enter into the baby's body as well. So there are chances of baby affecting by the gestational diabetes as well. For gestational diabetes, there are no visible symptoms present in the pregnant woman's body. However, with a simple glucose tolerance test, this can be detected and can be consulted with doctor. If a mother is already having history of diabetes in the family history, then doctors are aware and they recommend for the glucose tolerance test much ahead during the pregnancy. Mostly during second trimester of pregnancy, doctor recommends for glucose tolerance test and that is the time when most of the pregnant women are detected with gestational diabetes. With the increasing level of blood sugar in mother's bloodstream, this increases the chances of high sugar in baby's body as well. So there are certain risks associated with gestational diabetes. The first is it increases the chance of high blood pressure in mothers during pregnancy. It increases mother's weight and increasing blood sugar in baby's body increases baby's weight. So the chances of large baby or more baby weight increases a lot. When the baby size increases, the chances of C-section delivery also increases. The chances of developing type 2 diabetes increases more both for the mother and for the baby at the later stage of life. So these are certain risks associated with gestational diabetes both for the mother and for the baby. Now we'll see how to manage it. Now if you are diagnosed with gestational diabetes, let us see how you will be able to manage it properly. First and foremost, when you got to know about your gestational diabetes, connect with your doctor immediately. Based on the severity, doctor will start your medication and based on the glucose level, it will be managed by medicine or if needed, doctor will start your insulin injections as well. Whatever instruction given by doctor, follow it properly. You need to monitor your blood glucose level regularly. So again, doctor will advise you if in certain duration you need to check your blood glucose level and based on that you need to take your medicines and your food properly. Keeping a check on your weight gain and your lifestyle management matters a lot for gestational diabetes. Eating right food at right time will help you a lot to manage it. High protein, complex carbohydrate, leafy vegetable, more of healthy fat and more of fruits and vegetable will help you to give a proper weight range during your pregnancy. It will also help you to manage the blood glucose level. Do not underestimate the importance of activity during pregnancy. Follow gentle walk, prenatal yoga, any kind of gentle form of exercises during pregnancy. Activity is highly needed to continue the use of insulin in your body. Because the gestational diabetes has impact on your baby's health and growth as well, doctor will advise you to keep monitoring your baby's movement. At the same time, doctor will monitor baby's growth and development, if it is happening properly or not. So managing a healthy lifestyle, a healthy food style, proper activity, monitoring your blood glucose level and monitoring your baby's development is highly needed to manage the gestational diabetes. Although gestational diabetes nowadays has become more common, but this does not reduce the risk to the mother and baby during pregnancy. So it is always better to be aware since the very beginning of your pregnancy journey how you manage your food and lifestyle, so that at the later stage of pregnancy you can avoid getting into gestational diabetes. If you find this video helpful, then like and share this video with others. Subscribe to my channel and do not forget to click on the bell icon so that you will be notified of all the future videos. I am on a mission to help mother for a happy and healthy pregnancy. So I conduct the workshop regularly for Garbhasanskar and pregnancy preparation. So if you are looking for a happy and healthy way of preparing yourself for pregnancy and looking for Garbhasanskar and prenatal yoga, then find all the links given in the description. I wish you a happy and healthy pregnancy. Thank you.